We also hear that people don't want biopsies because they think that if you've got a lump in the breast, you have a biopsy, that's going to make it spread. And I've had patients very recently say this to me, and you have to try and fight against that, say, no, that's not the case. We see hundreds of patients a year. This is not an issue. But again, if it's culturally ingrained, it's very difficult to break that. Also, people think that all lumps are cancer. That's not the case at all. Most of what we see in our clinic are benign lumps. So again, if you're worried it's something, come and get seen. We'll be able to hopefully rule it out. But if it is cancer, then we can do something about it. Another thing is men don't get breast cancer. Men do get breast cancer. So we know about 400 men a year within the UK develop breast cancer. It's a small proportion compared to the overall number. But as I say, about 1% of the breast cancer that we see are in men. So at our unit, we treat about 1,000 cancers, and I'd say we see about 10 men a year with breast cancer that are treated and do well. So people will say to us, mammograms cause cancer. Mammograms don't cause cancer. So there's radiation involved, absolutely, but there's radiation involved when people have chest x-rays or they have CT scans. And when we travel, people don't think about this. So say you get on a transatlantic flight, you're getting radiation. So if you travel across from here to America, that's the equivalent of the radiation for a chest x-ray. So if you do a couple of transatlantic flights, that's the same amount of radiation as having a mammogram. People don't not travel because of the radiation risk, so why not come and have mammograms done? So it's a really important thing to try and break apart some of these to make sure that people come for the screening and they come and seek attention, really. And with the screening programme, so that's a programme, women between the ages of 50 and 70 are invited for mammograms every 3 years. Of course, if there's problems in between, they should seek medical attention and they can be checked out. Now, what we know is that people from ethnic minorities are less likely to come for their screening mammograms. And again, this will come back to the cultural taboos. This will come back to, we don't talk about breast cancer. It will give you breast cancer if you have a mammogram. All of this, and it all feeds into it. And there's cultural barriers with regards to language. So we do have lots of literature that's in different languages, but we also appreciate that there's a literacy issue in that people may speak different languages, but they may not be able to read that different language. So it's important that we go into communities, we go to places of worship or community centres and try and spread that message to just make people aware. Because people are invited, but they'll just put the letter to the side and not come. And we know that people don't do well if they come later.
Yes, definitely.